So our first panel is titled Mythologies of Race, Science, and Health. Before I introduce our moderator, I also want to acknowledge Rich Blint, who worked with me tirelessly, as Marsha said, in pulling these panels together, discussing and coming up with the ideas of, well, what are the conversations that we're going to present? What are the conversations that impact us as a community and we should discuss to see if we can find a way in or a way out? So again, thank you so much, Rich. Our moderator for our first panel, Mythologies of Race, Science, and Health, is Professor Sheldon Krinsky. He is the author of Genetic Justice, DNA, Data Banking, Criminal Investigations, and Civil Liberties. He is a professor of Humanities and Social Sciences. He says here at WFTS University, so you have me there, okay? Tufts, oh, that's Tufts. You know how these academics write, you know? Okay, Tufts University, and visiting professor at Brooklyn College. Please welcome Professor Sheldon Krinsky.
It's a real pleasure to be moderating this distinguished panel, and my job is to simply put forth a question of conversation so we can get started very quickly. First of all, let me introduce the panel members. To my immediate right is Alondra Nelson, who has written Body and Soul, the Black Panther Party, and the Fight Against Medical Discrimination. To her right is Samuel K. Roberts, who has written Infectious, Fear, Politics, Disease, and the Health Effects of Segregation. To his right is Jonathan Metlz, who has written The Protest Psychosis, How Schizophrenia Became a Black Disease. And last but not least, to his right, Harriet Washington, whose book Deadly Monopolies, The Shocking Corporate Takeover of Life Itself and the Consequences for Your Health and Our Medical Future. Please give her a welcoming. So I'm going to start the conversation among us by first asking, what mythologies did we all learn from writing our books that we would want to share with the audience today and discuss amongst ourselves? I'm going to start with 3 myths that I learned from writing Genetic Justice, which was really about forensic DNA. You know, when you watch all these crimes programs on TV, DNA rules, it seems. So these are the 3 myths that I learned. First of all, myth number 1, that DNA profiles are like fingerprints. Not true. Very different. Myth number 2 is that DNA evidence is infallible. Also not true. It's not infallible for prosecutions, and it's not infallible for exonerations. Myth number 3, collecting DNA profiles is race neutral. That's also a great myth. So let me turn now to Alondra, and maybe you can tell us what some of the myths were that you discovered in your work, Body and Soul.
Great. Good afternoon, everyone. Good afternoon, Harlem. Thank you. Thank you for the introduction, Sheldon. So I guess mine are more 3 truths than 3 myths. I begin my book, Body and Soul, with the sentence, health is politics by other means, which means to suggest that when we're talking about issues of health and science, that we can be talking about test tubes and laboratory benches and advanced scientific research, but we're also talking about contests over challenges to resources, over healthcare access, over access to scientific information, health education, and the like. So that's one truism. The second is that the civil rights tradition, the Black freedom tradition, the Black protest tradition was always a health activist tradition and a health politics tradition. So we can think back to Marcus Garvey's UNIA organization, which had a cadre of nurses called the Black Cross Nurses. We can think back to the powerful and brave Fannie Lou Hamer, who talked on the stoop when she was advocating for civil rights about being sick and tired of being sick and tired, and gave us the poignant euphemism, Mississippi appendectomy, to give voice to the experience of poor black women in the South who were sterilized against their knowledge, right? An issue that's been in the news in the last couple of weeks in California. And lastly, I want to offer for you that the Black Panther Party was a health social movement. The Black Panther Party is a kind of Rorschach test, I think, for how we think about black politics in the last half of the 20th century in particular. But I think what we don't appreciate so much is that they were deeply engaged and involved in issues of health activism, health equality, and access to medical care services in the United States. And in particularly, as I discuss in my book, they were engaged in giving people information to and access to services that were undermentioned, that we didn't know enough about, that the services were underutilized for or not provided enough for, such as sickle cell anemia. And they also had a national network of basic health care clinics that provided basic health care services. And notably, and I think particularly given Harriet's prior book that many of you probably know, Medical Apartheid, the Black Panther Party was engaged in protecting black communities from overexposure to the bad, forces of medical experimentation. So I write about one instance of this. I'm sure there's others, and I hope that other scholars will carry this forward. But the Black Panther Party participated in the 1970s in California in a struggle to stop the University of California from introducing medical protocols and medical research that would have disproportionately affected black and brown men and boys in Southern California. So they provided services and ways to respond to how black communities were underserved, and also protected black communities from the way in which we were disproportionately overexposed to the worst harms of medical research.
Thank you. Wonderful. Samuel, what about your findings?
All right, thank you very much. Good afternoon, everyone. Similar to Alondra, I've found some truths as well as some myths in my work. I focus as a historian on the late 19th to the mid-20th century, which in a lot of ways is the era of Jim Crow, but also the era of the birth of modern public health in the United States. And in doing so, I found that for many black communities, which were increasingly urbanized communities, that there was one particular disease that claimed the most lives, one cause of death, which above most others claimed black lives, and that was tuberculosis. And this is a disease contrary to the myth of racial predisposition, was actually one of living conditions and of poverty. So in many ways we find at the very birth of public health in the United States this mythology that, well, black people are dying from tuberculosis because they are racially predisposed, when in fact this was a way of masking some of the quite often impoverished and just plain out terrible conditions in which black people were forced to live. This was largely a product, by the way, and not incidentally, of residential segregation and exclusion from many jobs. The truth that I found, or that was the first truth, and the first myth that I found is one of the kind of race neutrality of public health. The way you mentioned, Sheldon, about the myth of race neutrality of DNA and genetics, or forensic genetics, pardon me. We tend to think in the history of public health as it being this rational science that has emerged as a way of thinking about society and epidemiology. And in fact, at the very birth of it, we find racial assumptions, which worked quite often to the detriment of the people it was supposed to serve. And then finally, the second truth I found is that, much like Alondra has mentioned in her study, that there has always been a black health activism. And the question is, where do we look for it? If we always think about the men, usually white men in white coats in hospitals, as being the locus of health knowledge production, then we may not find African Americans in the early 20th century there. But in fact, we find clubs, YMCA, YWCA, churches, Masonic orders, all being very much engaged in their community and environmental health in particular. Thank you.
Jonathan, what about your findings?
Great. Well, again, thank you so much. It's really a true honor for me to be here today. I work on race and mental health. I'm trained as a psychiatrist, and I look at the kind of